state business interests, fearing the cost of such a program, killed the bill every year. He was one of the few major American politicians and a rare Republican to declare access to good health care ought to be regarded as a basic human right. These were ideas that he had pioneered as the first Undersecretary of the Department of Health, Education, and Welfare over a decade earlier, and that he continued to press through leadership in the National Governors Association. In doing my background research for this centennial series, I came across the following description of his plan from the May 11, 1970 issue of Time magazine. First proposed to the New York legislature in 1967, but pigeonholed in committee ever since. Recently resubmitted in modified form, with a companion bill to encourage the formation of group practices. Would establish a set minimum benefits to be bought from insurers. 1, 90 days of in-hospital, including psychiatric care in a semi-private room. 2, outpatient X-ray, diagnostic, and other laboratory services, emergency care and minor surgery, physical therapy, and psychiatric evaluation. 3, hospital or physician maternity benefits up to $150. 4, hospital managed or other sponsored home care up to 100 visits a year. Patients would pay $2 in co-insurance for virtually all doctors, clinic, and lab services. The state would pay the premiums for all with incomes under $5,000 a year, split premiums in the $5,000 to $6,000 range, while those earning more than $6,000 would pay their own. To understand these numbers, $1 in 1970 is equal to about $5.34 today. So now we know where that $10 copay must have come from. I suppose it is very interesting, some 38 years later, to see what has changed and what has not in the national debate about universal health care. Tonight, we are pleased to welcome one of the nation's foremost authorities on healthcare policy. Dr. Mark McClellan is a senior fellow, the Leonard D. Schaefer Chair in Health Policy Studies, and the director of the Engelberg Center for Healthcare Reform at the Brookings Institution. In that capacity, he oversees the study of ways to provide practical solutions for access, quality, and financing challenges facing the U.S. healthcare system. He also co-directs an initiative to link the population-based research programs at Brookings with those of the Dartmouth Institute of Healthcare Policy and Clinical Practice. Dr. McClellan has a highly distinguished record in public service and in academic research. He was the administrator for the Centers for Medicare and Medicaid Services from 2004 to 2006, the commissioner of the Food and Drug Administration from 2002 to 2004, and a member of the President's Council of Economic Advisors and senior director for healthcare policy at the White House from 2001